We are doing sports massage pre-evaluation of hips and lower leg kinetic chain before massage. We start with Laslett's cluster.
Walking a little odd and having pain in your lower back?
Yeah, I think that I just pulled something at the gym and my hips hurt when I walk or when I lay.
Okay.
And so does my lower back too.
Oh, okay, great. Let's think. There's like some people that get like sacroiliac joint dysfunction. And I know that you used to be doing a lot of gymnastics and stuff. Yeah, and then you started settling down a little bit, right? So that requires a lot of hip coordination. So we're going to do something called Lasletts clusters on you. So it's just 5 tests. And then we're also going to have you hold your legs up too afterwards to see if there's anything wrong with you for your hips. And then if there was, we're going to then have you do some stability exercises for your core, which would be Superman for your back and your postural muscles in your back, and then your abs, we'd use the dead bug, which works your lower, middle, and upper abs. Is that cool?
Yeah.
Awesome. Okay, so for the first test, let's have you face down, and I'm going to do the sacral thrust.
Sacral thrust is our first test. Patient is prone. Push anteriorly into sacrum with fingers pointed to feet by being curled, and drive into sacrum straight down anteriorly with palm of hand. We are testing for provoked pain or discomfort that indicates a bilateral or unilateral sacroiliac joint pathology, such as ligamentous strain, gluteal muscle attachment tendinitis, OA, cyst, ligament laxity, and ultimately dysfunction, if at least 3 of these tests are positive, and unable to do active straight leg raise.
Any kind of pain or discomfort, let us know. I'm just going down softly, pushing on the skin down until I feel those prominences, and this is the top of your iliac crest, right here, about 45. It's going to be your sacrum right here. This will go on the top, and I'm just going to press. I'll just reinforce right here. I'm going to get above it. Anything? No. Okay, cool. So that's a negative. Now let's go ahead and have you face up. Great. So for this one, just lay like that. And
the next test we do is the ASIS distraction test, also called the SI joint shearing test or the SI joint stretch test. Client is supine with knees flexed and feet on table. We palpate and press bilaterally into the ASIS joints anteriorly, pushing posteriorly and laterally to shear the ligaments and joint. Capsules over the anterior SI joints at the ilium side. This literally shears the ilium against the SI joints by shearing the pelvis. Pain or discomfort provoked by this test is a positive test.
Alright, great. So that's a negative. Now we're going to do...
Next, we do the sacral spring test, also called the thigh thrust test, on the supine client. This test pins the sacrum, then pulls ilium away from sacrum to tighten ligaments on posterior SI joint to shear the posterior side of the SI joint ligaments and capsule. Take client's leg, bend it, and firmly push the thigh on opposite side into client's hip joint or femoroacetabular joint, while simultaneously taking a flat palm and rotating client towards you to firmly press sacrum anteriorly along client's anatomical plane to secure sacrum in place and push opposite direction of femur. Bone pressing ilium side of SI joints to shear posteriorly along the sacrum ligaments and tendinous joint capsules. Positive test is pain or discomfort. Now for the iliac compression test, also called the pelvic rock test. We have the client on her side and do this bilaterally like all these tests. We take our palms and place other hand on top to support hand on the iliac crest of client's ilium and press firmly down, and anteriorly then posteriorly while pressing down to drive ilium top into SI joint and shear both anterior and posterior SI joint. Incidental finding is a jump or muscle guarding that could be due to bursitis of trochanteric region of tendons attaching to femur. A positive sign is pain or discomfort provoked during exam.
So that sheared your sacroiliac joints as well, and nothing there, so that was -4 out of 5.
Genselin's test is the last of the Lasletts cluster of 5 tests to indicate SI joint dysfunction. Have supine client along the edge of side of table with leg off table and other leg bent at the knee and holding the knee by chest. Then push firmly on bent knee down and on the leg that is off table to separate the SI joint. If injured, it would be positive for pain or discomfort. Not a sensitive test for SI joint dysfunction, and done last, due to it also triggering low back pain, hip pain, knee pain, etc. in those clients. If 3 of those 5 tests are positive, there is more than a 60-70% probability the client has SI joint dysfunction. Do the active straight leg raise or ASLR test to see if unable to hold legs, raise legs, not keep legs raised, are shakes or is uncoordinated while client actively lifts both legs about 10 inches off the table and holds for up to 30 seconds. Positive test if the client has pain or discomfort as well. Our client does not have any positive test of the Lasletts cluster for SI joint dysfunction. Her aches could be due to musculature or soft tissue injury, postural changes, injury along kinetic chain from hip to ankle that is affecting gait and posture, and so on. Let's see how our client's hip hinges with a squat position.
It is good she doesn't have SI joint dysfunction, as it could be due to any number of pathologies a massage would not be able to correct. Or heal on own without referral to a medical specialist for pathology such as sacroiliitis, ankylosing spondylitis, osteoarthritis, metastasis, cyst, infection of ligaments surrounding SI joints, endocrine disorder, sprain of joint capsule, and so on. Muscle aches with mild strains from overuse or working out would benefit and heal with massage. The hip hinge is useful to gauge the extent of hip pain a client could be having. See how far and without pain your client can do a squat by hinging at the hip, pushing buttock to back wall. Tucking scapulas into back pockets figuratively, tucking chin in by using finger to push posterior on chin, and breathe from diaphragm. The buttock of client in squat position without any lower kinetic chain or hip injury should see the spine parallel to the shins and buttock close to the floor. Knee should not turn inward, indicating hip instability. The ankles can be a limiting factor in performing a squat as indicated. This is due to the ankle lacking proper dorsiflexion. That could be due to aging and arthritic changes. Loss of hyaline cartilage around tarsals and ankle bones, injuries that didn't heal properly, or misaligned talus along the ankle mortise joint. And so on. You can improve ankle stability and range of motion to get a better squat and better posture with use of a wobble board.
But I mean, actually, just like this. Touch your finger to the chin and push it back. Good. Awesome. Okay, now you can go ahead and come up. So for you, you're limited by your squat at your hip, but you would keep doing that 3 sets of 10 until you could get it down. And then for your ankle, let's see your ankle squat down again, and let's see if you can get further down. Oh yeah, you got some pretty good ankle movement right there. Let's see from the front too. Go ahead and squat down. Now your legs aren't turning in, so that's good. That knee's turning out a little bit. That one's a little more inwards than that one. So go ahead and do it again. The squat. Looks good. Alright, cool. So your hips and your pelvis seem to be fine. I would probably work on your ankles. So let's go ahead and see how your motion is with your ankles.
The use of a wobble board is ranked high for ankle injuries that are due to ligamentous sprain healing and to regain range of motion muscular strain. Misaligned tarsals and fibula and tibia along the planar joint line, infection, post-surgery from trauma, and so on. The proprioceptors in the Golgi tendon organs need to be better tuned to send correct alignment for proper movement in ankle. Dorsiflexion and plantar flexion, as well as eversion and inversion. Use a wobble board to move your foot into only each of those directions without making the board wobble. Use slow and controlled movement to retrain your nervous system with neuroplasticity to have better form and posture to improve. Gait and higher kinetic chain movements that depend on proper ankle joint function like the knees, hips, pelvis, spine, torso, and arms.
Wobble board is great for using the open chain movement to isolate the tendon GTO where proprioception and the muscle spindles in muscles to react to movement and adapt for stability, balance, and coordination. This is dorsiflexion of the foot.
Yeah, and just hold the wall for support, but I want you to like put your foot in the center of it. Right there, yeah, and now do this. Dorsiflex your foot. Yeah, and then do that 10 times. So you're gonna just go up. Yeah, let's see how it feels. Can you keep it straight the whole time? Take your time, it's fine. How does that feel?
It feels fine.
Okay, that's an open chain exercise where you're no longer using the top portion of your body on your ankle and you're actually bringing stability to your ankle.
After doing dorsiflexion with heel driving back on board to floor, we do plantar flexion 10 times to drive toes into floor forward on board, seeing if the board can be kept from wobbling and to build coordination and neuroplasticity of proprioceptor nerve fibers in muscle, spindles and GTO of tendons.
How is that?
That's okay.
Okay. And then keep doing that. It's a little difficult at first, huh?
Yeah, a little bit.
You can do that 10 times. It's kind of moving some. A little bit of instability right there. So that one is your S1 for your back, your calves. Do it like a few more times.
Dorsiflexion worked common fibular branch of sciatic nerve along L4 and L5, while plantar flexion works the tibial branch of sciatic nerve along S1. Now 10 times of foot aversion to drive inner foot down on board, lifting the foot upward and outer on board. In those who have rolled their ankles before, doing foot aversion can be difficult to keep the board steady due to laxity of ligaments not becoming taut, or scar tissue making the ligaments scar over and shortened along the calcaneofibular ligaments on outer ankle. These foot aversion wobble board exercises help correct both injuries for better body coordination.
So it could be the anterior talofibular ligament, or it could be the calcaneal talofibular ligament, or it could be the posterior talofibular ligament. Yeah, you're gonna have to do better than that, Bailey. Are you doing it already?
No, but I'm like,
Okay, now let's do inversion. So now you're gonna, oh no, that's just more eversion. Because for inversion, you're gonna go like this.
like this.
Yeah.
Now we are doing 10 each of foot inversion to drive foot on outer side of board and invert foot up along medial foot.
Or like the
This could be easy or difficult in those with previous ankle injuries. The limitation could be at the calcaneus talus joint line, with the calcaneus displaced medially for inversion and laterally for aversion irregularities as one reason. Neuroplasticity trains the brain to adapt to new body changes with active work in these exercises done by the client.
Like, you're gonna need to work on that. To strengthen your ankles. Yeah. Oh, rolling it all the time. But you can still work on it. You can do 3 reps 3 times a day.
Really?
3 sets of 10. Or you can do just 1 set of 10. If you want to just do it 3 times
I'll
a
get my
day.
clothes out of the driveway.
Okay.
1 set of 10. You do that. Did you want it?
No, it'll work.
Oh, okay.
I don't think he's gonna come with
You're
anything.
bored with it already.
No, I'm not bored. I'm trying to like
Yeah.
be sick.
Okay, now let's see your other ankle. Now let's go ahead and do dorsiflexion. So
Our
you're-
client is young and looking discouraged. She should know she can improve her ankle mobility for better posture, hip hinge, squat, gait, and so on.
Your back's next to a little bit support.
Yeah.
And then that's about 4, 6 more times. Can you bring it closer to you? Just so that we can get like a better.
This way?
Yeah. Watch your toe over there. It's pretty good. It's healthy.
Yeah, this one's
Alright, a couple more times. Hey, Brutus.
Brutus.
Yeah, nice. Okay, now bring it closer to you. We're gonna do the plantar flexion. Okay. And then you're just gonna toe down. And up, back up. 10. Good. So good. Neutral. This is your plantar flexion.
Encourage your client to do these exercises and make a plan to do them 3 times a day, or 1 time a day 10 times each movement of dorsiflexion, plantar flexion, eversion, and inversion. These work.
For each movement, so you're going to do dorsiflexion, plantar flexion. Okay, now we're going to do eversion and inversion. Okay. So go ahead and do the eversion first. You're going to have your inside down, like that, and your outside up. Yep. And you can put it on the
There seems to be a limitation to foot eversion on client's right side. Her foot is not everting as easily as other foot, and seems stuck up the kinetic chain at the knee, possibly the hip. This could affect gait and posture for better. If she keeps mobilizing her ankle, that will also mobilize her knee to bend correctly and not be stiff in this young, healthy client.
Looks like you're recruiting your knee to help you though.
I know.
Yeah, you're eversion on that side.
It's not good.
It's like you have a limitation on your ATFL or your posterior one.
Yeah, I feel like it just won't get down.
Okay, now let's look at your inversion.
This way.
Yes. Yeah, you're moving your whole
My
head.
knee.
So something's wrong with your knee. Are you feeling it in your knee?
No, I don't feel it in my knee. I feel like my foot when I try to move it down, like it doesn't want to go.
Oh, okay. Yeah, so your whole kinetic chain up to your hip.
Thanks so much for watching. Use these in your next pre-evaluation sports massage if time permits to better enhance your healing outcomes for your client with chronic pain or discomfort associated with musculotendinous or ligamentous soft tissues of the body. Schedule your next sports massage today or other fabulous massage. Reward your body for all the work it does for you to prevent injuries later from overuse, fatigue, stress, and so on.